these women, they do not have any abdominal wall weakness, they do not have abdominal hernias or bulges, and the circulation provided by these flaps is far superior compared to a tram flap. The outcomes are great, and the success rates with these procedures are in the tune of 97-98%. We look for these tiny blood vessels that pass between the muscle fibers, and they provide circulation to the overlying skin and fat. So essentially, we are using the same tissue like we do when we do a tummy tuck operation, but instead of sacrificing this entire rectus muscle, we dissect these blood vessels and make tiny openings between the muscle fibers, dissect those tiny blood vessels, and now once it is completely dissected, we use these blood vessels to reconstruct the breast. Once we bring the tissue to the chest, we then reattach here to the blood vessels in the chest. This involves microsurgery. The sutures that we use for reattaching those blood vessels are even smaller than the tip of a hair. Since I am using the patient's own tissues, there are very minimal chances of these getting infections. And if there is infection, we can treat them with antibiotics. The fat and the lower abdominal skin is from the same patient, so the consistency on how they feel and look are natural compared to an implant. I am the only plastic surgeon in this Omaha metro area who is performing this procedure, and we did have very good results with few of the patients that I performed recently. I am fellowship trained in performing these procedures, and we have performed more than 100 of these procedures.